All right, good morning, everyone. Thank you for the opportunity to present. We have no disclosures. So starting with background, the healthcare industry actually accounts for almost 10% of all greenhouse gas emissions in the United States, with operating rooms producing almost 1/3 of overall hospital waste. And importantly, although there is renewed interest in decarbonizing the operating rooms, surgical trainees are not routinely educated regarding the environmental impact of surgery as well as how to mitigate it. So our objective was to perform a structured needs assessment for a surgery resident-focused sustainability curriculum. Using Kern's 6-step framework for curriculum development, we conducted three focus groups with surgery residents to perform a targeted needs assessment. There were a total of 14 participants across 4 institutions, and there was representation across multiple surgical specialties and all PGY years. These focus groups covered 3 topics. So the first was the current state of surgical sustainability curricula. The second was resident knowledge regarding the environmental impact of surgery. And the third was preferred educational methods and topics within sustainability education. All focus groups were recorded, and coding and thematic analysis was performed using the transcripts. So our analysis revealed 4 themes. The first theme was that surgery residents really receive little to no formal teaching on the environmental impact of surgery or how to reduce this impact. Despite this, most residents did understand that climate change is a global threat and that operating rooms do generate significant amounts of waste. But what most residents lacked was a framework to both quantify and measure this waste and its environmental impact. And very few had an understanding of the trajectory of operating room waste or how supply chains were managed at an institutional level. The second theme we identified is that there is significant variability in the levels of interest, awareness, and prior education related to sustainability among residents. So while most residents had little to no formal exposure to surgical sustainability, others did have experience independently pursuing scholarly work focused on this topic. And what was important to know is that residents who did have a background on sustainability kind of reported that individual interest is what really drove their most of their prior learning and education. The third theme is that there are numerous perceived barriers to the implementation and practice of environmentally sustainable surgery. So, for example, several residents pointed to a lack of institutional support, cultural inertia around certain practices, the inherent hierarchy of the operating room, and an emphasis on efficiency as things that made it difficult to voice concerns about sustainability or challenge the status quo. And last but not least, the fourth theme that we identified is that residents prefer to learn practical methods to reduce waste in an interactive and hands-on manner. So specifically, residents really want to learn about actionable steps that they can take to reduce their carbon footprint in the hospital. And most preferred an interactive curriculum focused on practical quality improvement initiatives. The other thing that residents suggested is that they wanted the curriculum to be tailored to the PGY level. So for example, a general review on climate change and human health may be most appropriate for an intern, but a focused review on the waste impact of a particular supply may be especially relevant for our chief residents who will soon be making their own preference cards. So based on our needs assessment, we kind of envisioned a 3-part curriculum. The first and kind of foundational part of the curriculum would be a series of self-paced didactic modules about sustainability in surgery. The second part of the curriculum would be a series of case studies highlighting actual sustainability improvement projects that have happened in the past. And these case series would kind of highlight the successes, implementation barriers, as well as failures from which the residents can learn. And the last part of the curriculum kind of focuses on like a longitudinal QI experience where residents can guide or contribute to sustainability-focused QI projects for the residency program. Thank you so much, and I'm happy to take any questions.